Hi everyone, and welcome to our weekly message. I hope you were all able to enjoy some time off over the past week. It was lovely to see the sun out again. It gives us all a sense of hope in the midst of all this uncertainty. Well, you'll have seen from our daily staff briefings that the number of patients in our hospitals with COVID-19 have been quite stable over the past 2 weeks across both Poole Hospital and the Royal Bournemouth Hospital. It's really encouraging to see that the spread of COVID in Dorset isn't moving as quickly as other parts of the country, particularly London. We think this is because social distancing came in at a time when there was still relatively little COVID-19 in the local community. I'm sure that we all want to say an enormous thank you to our communities who've adhered to the government advice and who've been staying at home. Thanks also to everyone who's been adapting here in the hospitals to physical distancing at work. I do appreciate it's not always easy, particularly in a clinical setting, but it's really important to help stop the spread of further infection. Please make sure that you're role modelling this wherever possible, and remember that it really is okay to ask people to stand back a bit. So lots has been happening this week regarding the expansion of staff testing, and of course this will be a vital tool in monitoring and stopping the spread of COVID-19. We're delighted that we now have the ability to undertake testing on site with a really rapid turnaround. With the national focus now being very much on testing, we should be ramping up this capacity for our staff and our patients over the next few weeks. The good news is that this delay in the flattening of the peak has given us a bit of time to learn from others and provide more training for our staff. This week I was really pleased to visit our porters to be able to thank them for all their hard work in supporting all the changes that have happened across our hospitals, and of course for everything that they do every day for our patients. Porters are often seen as the beating heart of any hospital. We love their enduring sense of humour, and of course they're vital in keeping everything moving. It's now much more challenging for them to do their job, moving around the hospital with all the different PPE requirements, but it was really great to see they're still cheerful, and as always they're rising to this challenge. Well, with all the national headlines, I know there's still anxiety and worry about our use and supplies of PPE. Once again, I'd like to assure you that we are following all the Public Health England guidance to protect you and our patients. We're really clear about what PPE should be worn in the different areas, and it's so important that all staff follow these guidelines. Our supplies follow a push system, which means that deliveries are based on the number of patients, our expected use, and where we are in terms of this surge. So we won't have the large stockpiles that make everybody feel confident, but our deliveries are coming as expected. The guidelines have changed in the past couple of weeks, and we monitor the situation very closely. If there are any further changes, we will of course let you know, and the Trust will be responding really quickly to that. But it's not just PPE that's causing worry, and we know that there are huge concerns about a number of aspects around working and living with COVID-19. I was really privileged to take part in 2 virtual Schwartz Rounds over the last month, where both our trusts were able to get together, where staff were able to talk about how they were feeling on all that was going on. It was so good to talk openly together, to understand the impact that all this is having, and to be able to support one another through having really honest, open conversations in a safe environment. I'd just like to thank Dr. JP Carpenter and Dr. Sean Weaver, the 2 who've been leading this work. It was really powerful to be able to join in, and we look forward to more virtual joint sessions that allow more staff to take part. Your physical and emotional well-being is of course paramount. Each and every one of you makes a huge difference to the quality of care provided to our patients, and as such every single one of you deserves an exceptional level of support. That's why our joint organisation development and occupational health teams working across both trusts have put together an enhanced wellbeing and emotional support package to help you through this very unsettling time, whatever your role. Do look out for the wellbeing posters, the business cards and the booklets showing 3 main helpline numbers for the occupational health team, Care First and the NHS-wide helpline. This overall package of support is in line with all the NHS is doing nationally, and we're working with our national and local partners to implement this. We really do want to get this right. So if you've got any thoughts or ideas on how we can do it better, please do contact our teams in Bournemouth and Poole. They'll be really pleased to help. So in closing, I'd just like to reiterate that you as an individual really do matter. We appreciate all your hard work and your flexibility in providing care for our patients in these difficult times. Thanks again to you all.